Hi everyone, very good morning guys. I hope I am audible and visible to all of you. A quick confirmation please. Please let me know if I am audible and visible, and a quick thumbs up or a quick yes in the chat box, and we are good to go for that. Right, so first and foremost, I'm meeting many of you. Uh, Maybe I've met you on YouTube, but I'm meeting many of you for the first time after the NEET PG exam got over. So definitely it's like a happy moment that we've finally gotten over with the exam. And by now, I'm sure all of you have gone through way too many recalls. So by now, you know the answer. So, there are two reasons of why you're here. Either you're here because you wanted to meet me, or you're here because you have probably, been a part of this journey and you want to probably prepare either for INI or whatever it is going forward. So yes, welcome to this class. We are going to quickly go through all the pathology and microbiology questions that came in the NEET PG. What are the learnings for it from it? How should you be proceeding forward going for INI? And for students who are going in for the next year NEET, next or FMG, what should you be doing and how should you be benefiting from the same, right? So yes, let's get going. A quick thumbs up if all's well with the AV, and we can begin. Yes, okay. Okay, fine. So now, what do we have? Let's start with question one, and it's open to, of course, a lot of customization because you guys gave the exam. So it has to be like first-hand experience is what is you guys having. So you can probably help the others by, adding on with your options and all. So let's start. The first question, in fact, there was a lot of hemat has anyway gone above. If you look at the overall pattern, so hematology questions have overall increased in any exam format that has happened. So first and foremost, we have, just give me a second. Acha. So yeah, we'll come to that question, Dr. Kumari. That is a question which I am still struggling with because everyone is giving me very different. If someone's saying family history tha, someone is saying family history nahi tha. Someone is saying that was a 12-year-old boy. Someone is saying it was a 5-year-old boy. So there's so much of discrepancy that I am just telling answers. कि अगर ऐसा था तो ये answer और वैसा था तो वो answer. So whatever you can recall from the exam, then you will decide that what answer because everyone is giving me different feedback on that question. We'll come to that also in a while. So first and foremost, what are the features of DIC? There was a feature of DIC wala question. So we know that DIC with low platelet count, and there was a clinical history of DIC that was mentioned, low platelet count, and there were blasts with OR rods. And of course, they were probably talking about the very famous faggot cells. So they were wanting to ask you the translocation. Now the translocation was what? Because what were we thinking of? With DIC, I told you, na, there's only one leukemia in the whole wide world that can be associated with DIC, and that leukemia is going to be AML M3. So AML M3 ka we used to take in multiples, na 3 5s are 15. So translocation 15 17 is what you see in AML M3, and that was the answer over here. But you had a lot of other students who are going forward, maybe for INI or FMG students or next year students. Please sun lo, where do we see 821? Translocation 821 is seen with AML. Come on, even students who have given the exam, I'm not letting you forget this information because with a lot of effort we have learned it. What is it? It is AML M2. M2 shows you translocation 821. How do you see in version 16? 4 4s are 16. 4 4s are 16 matlab AML M4 is going to show you in version 16. And translocation 122, first chromosome, almost last chromosome. First and last. So वो last वाला AML में दिखेगा. It will be seen in AML M7. So remember, first chromosome, almost last chromosome, AML M7. These were the other ones, but DIC लिखा था, maximum OR rods लिखा था. It was definitely AML M3, definitely translocation 1570. Okay, guys. Coming on to the next question. Another much expected question where you had some people said 65, some people said 52, 55. So basically, elderly person tha. That was the recall that we got, and an elderly person came to you for a medical examination and got a marked elevation of lymphocytes and leukocytosis. देखो blast तो word में ही नहीं था. There was no blast thing there. So acute leukemias are out. Lymphocyte was there. Elderly person. I start thinking of CLL, but I need other criteria, and they've given me a picture. That picture is of what? ये क्या था, guys? This picture was of the smudge cells. Now, smudge cells is not specific, but smudge cells is a very, very strong indicator that it could be a CLL. So next क्या करेंगे? Can you quickly recall for me what is the criteria for CLL? And wherever I put dash, because other options have not been recalled by the students as of now. But either ways, matlab, there are some questions for which the answer is clear cut. Whatever may be the other options, we know that the next investigation or next step is going to be a flow cytometry. So criteria क्या होता है? There are three criteria for the diagnosis of CLL. Number one, lots and lots of lymphocytes, which they've anyway mentioned. So the absolute lymphocyte count should be more than 5,000. That is one criteria. Then bone marrow ka lymphocyte should be more than how much, guys? Bone marrow lymphocyte should be more than 30%. So it's all about lymphocyte that you have. And finally, your CD5 and CD23, सब कुछ positive. That is what we used to study for CLL. CLL was सब कुछ positive. 5 also positive, 23 also positive. And how do you measure that? You measure that with the help of flow cytometry. So see, the first two things were lymphocytes. That the examiner has told me. Lymphocyte wala version examiner has told me. Two criteria he has fulfilled. So my next criteria will be fulfilling the flow cytometry, and that is what I did. I'm going to do a FCM. ये वाला question, I hope all of you got it right, because ये काफी बार this criteria we used to do again and again and again. So I hope you got it right. And thank you, Doctor Abhineet. It gives me so much happiness when you guys come back and use the word, ma'am, the exam went well. I know no one knows what the rank and the score and what branch and all that is too far-sighted a thing to think of. But just the mental satisfaction that how we put in so much of effort, so many a million rapid reviews that we saw and T&Ds and 1 billion classes that we did. At the end of it, when you come back and have that sigh of relief that it went well, it gives you a lot of happiness that yeah, you put in that much of effort and it paid off. It didn't go all in vain, it paid off. So it's trust me, I can understand, I can totally relate to it. It's a very, very, very good and very satisfying feeling. But I hope you guys are now not feeling lost, because many students feel like lost because you are so used to studying now for 16-18 hours and just sitting and only thinking about single track one thing in life. So you really don't understand now what to do with the time that you've got. But trust me, this is the most golden phase of your life. This is never gonna come back, because soon you will be looking for jobs, you will be doing some JR-ship, you will be going in for some soon after a few months you'll have residency. Life's gonna be very hectic. Trust me, any hobby that you wanted to pursue, any trip that you wanted to take, or if you just want to sit at home and just do nothing in life, that is also acceptable. If that is your passion, that मुझे कुछ नहीं करना है, कुछ नहीं करना is also a very, very happy thing, happy place to be in. Even if you're in that phase, just enjoy this time, because it's one of the rare events in the time of a medico, where you in the life of a medico, that you get this phase, few weeks or months, where you can just sit and do nothing. That time will never ever come for the rest of your life. So just make the most of it. ठीक है, right? बिल्कुल नहीं मिलेगा दोबारा. Trust me, from personal experience, I'm telling you, every time and every phase of life, you will feel that, अच्छा, अब this will get over and I will have a lot of free chill time in my life. Chill time never comes, and trust me, this is the only time it has come to you guys. So don't waste it. Make the most of it. Whatever you had kept in your bucket list, pending list, kar lo. Don't just, although I am also taking a recall session, but don't just, my advice is, don't just jump into the ocean of recalls. Give yourself a little bit time. हाँ, INI CET के लिए पढ़ना है, but it's okay. I mean, even if you give like 1 week, तो ठीक है ना guys. अभी तो इतना fresh पढ़ा है. At least 1 week तो दो. But हाँ, 1 week के बाद, if you're targeting INI CET, you get back to your original routine. But at least 1 week, your mind needs a detox. Otherwise, you'll go into mental exhaustion, right? Then you'll just chuck the plan of giving INI CET. But abhi ke liye, you deserve those 5 to 7 days. Give yourself those days. Quite ironically, I'm saying stop listening to recalls. Okay, having said that, let's move on to the next question. There is breast carcinoma with good prognosis. Breast carcinoma with good prognosis, surgery या path, जो भी question बनाना है बना लो. But this was answer was what? Option A. So there's ER positivity. ER positivity basically means I'm falling under the luminal category. Either it's luminal A or luminal B. But how do we differentiate between luminal A and luminal B? We look at Ki67. Luminal A has Ki67 as less than 14%, and luminal B has Ki67 more than 14%. So I had an option of Ki67 high, and that is not a Ki67 high, matlab more proliferation. So that is not a good prognosis. That is bad. Next, P53 policeman mutation, so everywhere is bad only. What is P53 mutation known as? Agar hereditary hai, what is the syndrome known as? Policeman ka syndrome kya hota hai? That is a leave from any syndrome. So leave from any syndrome is obviously a bad policeman wala syndrome to have. BRCA1 is associated with triple negative breast cancer. That is of course a very very bad breast cancer. So the only one with the good prognosis that I could think of was ER positive. Clear cut answer, always expected. Luminous or in sab pe question aata hai, one had to come. So it was again a an expected topic on the whole that you had. Moving on to the next one, chronic smoker lung cancer. Firstly, if I stop the question over here, chronic smoker with lung cancer, तो smoker के साथ only two cancers go in the lung. One is squamous cell carcinoma, one is small cell carcinoma. तो adeno and large तो वैसे ही we have ruled out. They have said there were large pleomorphic cells and mitosis. Large cells वो cancer है तो squamous में भी होगा, small will भी होगा. But they said along with hypercalcemia, as soon as this paraneoplastic, I think 1 million times तो we have done na that lung carcinoma वाला table हमने करा था, है ना? If you remember that we did what are the paraneoplastic syndrome, what are the markers, and that those 3 flashcards we've done 1 million times. And I used to tell you that the way you write squamous, तो वो instead of Q, you will learn it with C. So squamous cell is the only one that has the K sound, squamous. So that is the only one that is going to have hypercalcemia. So calcium wala was seen in squamous cell carcinoma. So again, this was a clear cut. If it would have been, you had listened to those 1 million time revisions that we did. So this must have been resonating and, just ऐसा वो सेम वॉइस मस्ट बी कमिंग बैक टू योर माइंड कि बार बार मैम यूज टू एम्फोसाइज ऑन स्क्वामस के मतलब कैल्शियम, तो दिस हैड टू बी स्क्वामस सेल कार्सिनोमा, नो अदर ऑप्शन. हाँ, इफ द सेम क्वेश्चन कम्स एज अ स्मोकर एंड दे से मैक्सिमम पैरानियोप्लास्टिक सिंड्रोम्स आर सीन, देन यस. रिमेंबर दैट छोटा पैकेट बड़ा धमाका स्टोरी, वी यूज टू डू दैट. इट साउंड्स छोटा बट इट हैज एवरीथिंग मैक्सिमम, बड़ा धमाका. सो मैक्सिमम पैरानियोप्लास्टिक सिंड्रोम्स वर सीन विद स्मॉल सेल कार्सिनोमा. ये वाला क्वेश्चन भी हो गया. मूविंग ऑन टू द नेक्स्ट. Again, African child I have added. African child was not given in the question, but I did not want to take away his limelight because this African child is very, very famous, and that child has one question every time on him. So I thought that this time they did not give his photo also. This time they did not mention African child also. So uska pura aisa limelight they've taken, but the question is still the same. Okay, despite them not giving him any credit, but the question is the same. There was a jaw swelling, and the bone marrow or that swelling was showing vacuolations. You could see these vacuolations. Of these vacuolated wala photos come only twice in pathology. ये जो hematology का vacuolated cells है ना, firstly these vacuolations basically contain fat. Fat matlab they are oil red O positive, right? That is an indirect question that they could give you, and they will come only twice. Leukemia पूछते तो I would have marked ALL L3 if they would have asked me leukemia. If they ask me lymphoma, like यहाँ तो jaw swelling है ना, jaw मतलब it's not blood cancer, jaw मतलब there must be a lymphoma. Then the lymphoma I will think of is Burkitt's lymphoma. They are now said to be almost like cousin brothers. One is leukemia, one is lymphoma, but they look same cousin brother type. ठीक है? So Burkitt's lymphoma का B looks like an 8, and you had to correlate always with an even number. Whatever even number was given in the paper, that is how you learn Burkitt's. Na? Burkitt's is always translocation 8 with an even number. So 8, 14, 8, 22, 2, 8, whatever 8 and even number hoga, to wo Burkitt's lymphoma hoga. That's why I've not written the other options. Whatever was there in the exam, happy be the examiner may be happy with it. Hame apna answer pata hai, it has to be 8 with an even number, and that was sorted. And yes, everyone's okay. How going forward will it come? So going forward, it's going to be either associated with ALL L3, same story hoga. ALL L3 will also show you vacuolations. Those vacuolations are also going to be fat and oil red O positive. Let's move on to, this is the question which has created the maximum controversy that I can say. So pehle to this, you will have to tell me. I keep adding on to it. Because no one told me that age kya tha. So now you need to tell me that kya kar sakte hain is question mein, right? And Dr. Priyesh, yes, now that March 5th exam is done. So obviously the next targets are gonna be for two set of students, which I will not club. I will keep these two categories totally separate because दोनों का preparation बहुत different है. One is going to be the preparation for INI CET. One is going to be the preparation for the June FMG, targeting June FMG first. ठीक है. So again, like I'm saying that. I am going to definitely keep these two things very, very different, and I will be posting daily targets. Abhi, I thought that everyone would want to celebrate Holi, so after Holi, I thought I will start. So basically, from 9th, I'll be starting and I'll be posting targets for this, and whatever beach mein classes we keep having, wo bhi start ho jayega. ठीक है? Okay, so on that note, moving forward. Yes, इसके अंदर now I don't know what was the age, like Dr. Kumari was telling us in the beginning कि मैम 5-year-old बच्चा था. A lot of people told me कि थोड़ा advanced stage था, मतलब it was an adult patient. So age is a big question mark to me right now. But whatever other history I got, picture यही था. So what is the picture showing you? The picture is definitely showing you the presence of spherocytes or microspherocytes. And I know along with that many people said that splenomegaly भी था. So now what have students done is because splenomegaly था, they said that spleen है और spherocytes है, तो ये तो होगा hereditary spherocytosis and osmotic fragility is what we are going to do. So they asked you the disease and the next step of action. So you said hereditary and OFT because spleen था. But tell me one thing, what is the most common cause of microspherocytes? That is something I've taught you so many times. What is the most common cause? Forget spleen. अभी spleen भूल जाओ, सब भूल जाओ. Just think of most common cause. Autoimmune hemolytic anemia, the most common cause. So many times I've shouted this story out. The most common cause of spherocytes is not hereditary spherocytosis, it is autoimmune hemolytic anemia, for which we do a Coombs test. Now many people said कि मैम splenomegaly दिया था, तो then तो splenomegaly. Why do you feel splenomegaly is only seen in hereditary spherocytosis? Tell me one thing that autoimmune hemolytic anemia is also hemolytic anemia. It also shows you extravascular hemolysis. If this also shows you extravascular hemolysis, then spleen तो इसमें भी होगा. So this is no criteria of differentiated that spleen था तो I marked hereditary spherocytosis. Spleen can be there in HS also. Spleen can be there in AIHA also. Spleen is no criteria. What could have been? Now यहाँ तक तो my answer is AIHA. But now what I leave it open to you guys because you gave the exam is कि you have to tell me अगर तो बहुत छोटा बच्चा था, something like a 5-6 ऐसा टाइप का बच्चा था, and there was a family history present. If there was a very young kid with a family history present, then I will think of hereditary spherocytosis. But अगर middle age मतलब above a 12-year-old and there was no family history, then I will think of AIHA. So of this much of, I am still, like I said, I'm still struggling because no one has told me exactly कहाँ पर domain था, but I've told you what to answer. Very छोटा बच्चा, like Dr. Kumari is saying that similar episodes were present since birth. Then obviously we would want to think more in favor of HS. But again, other than you, honestly, abhi tak this is not something that students have told me. So this still remains as a question mark wala question because exact मुझे बस कोई age और history बता दे तो my answer is ready in front of you. But going forward, I have told you how to approach the question. If this question comes again, you know what to see. Family history है, repeated episodes since birth, go more in favor of HS. If there is no family history, then AIHA. Hepatosplenomegaly was given, that is fine. That can be seen in any extravascular Acha. So liver was also there, but that's okay. Any extravascular hemolysis can show you hepatosplenomegaly. So hereditary spherocytosis is also extravascular hemolysis and AIHA is also extravascular hemolysis. So दोनों में दिख सकता है. But that was not the differentiating criteria. But अभी के लिए, since not I've told you, मतलब अभी के लिए I can't tell you the answer to exactly what the answer to this is because we don't know the discrepancy. Going forward क्या आएगा, that I have already sorted for you, right? Moving on to the next question. There were two questions which came from the most expected nephrotic, nephritic as usual. There's a 5-year-old छोटा बच्चा with cola color urine. I know pediatric population पूछा, तो pediatric population में PSGN is something which is very, very characteristic, right? Elevated creatinine was there. there. Again, someone said that there was a past history of impetigo, someone said there was a past history of pyoderma. Either ways, basically कुछ streptococcal infection they are trying to denote to me, whatever they might be trying to say, pyoderma, impetigo. So basically some streptococcal infection and cola color urine and a बच्चा post streptococcal glomerulonephritis. अब यहाँ पे discrepancy क्या था? Some people have given me this, okay, ma'am, this was the history, associated electron microscopic finding was asked, and that is why we called it KPSGN में we see subepithelial humps. Only like say 50-60 odd students have told me that in the question it was written that electron microscope, you can give me a confirmation. So people are saying that there was a question which said that electron microscopy shows you crescents, and then that is the basis that answer में लिखा था is it PSGN or RPGN or MGN or MPGN, ऐसा question था. Because अगर crescent word mentioned था, I would have selected RPGN, of course. Then I would have gone for RPGN. But very few students told me that version. Most of the students have told me this version of the question. So that is why, going by majority, I selected this version of the question. But I'm telling you, just in case if you can recall कि उसमें crescent word यहाँ लिखा था कहीं पे, if that word was used, then I will go in for RPGN. 3 weeks and 3 weeks अगर था तो all that is going in favor of PSGN. That is okay. Because हाँ, some people also told me कि नहीं मैम 2-3 days का history था, 2-3 days में तो it becomes IgA nephropathy. But IgA adult, A for A ना, IgA nephropathy adults में होता है, यहाँ तो adult नहीं था, ये तो बच्चा है. So again, going by 3 weeks वाला history and going by a bacha with cola urine with this history of streptococcal, my answer is subepithelial humps. And yes, everyone saying crescent nahi tha, so maybe some students have mixed it up with some other questions, so we'll consider this version as the final one. There was another question regarding subepithelial humps which was to do with spike and dome pattern. What was the answer to that? There was a spike and dome pattern. So spike and dome pattern, I think you guys have always 3 week में RPGN नहीं होगा. See, RPGN is a clinical term. Clinical doesn't mean that एकदम से it has 3 week लिखा था तो मतलब. I'll give you one more example. Tell me, when you read PSGN का total duration of the disease कितना है? मतलब I'm not saying in how much time cola color urine comes. I'm saying in how much time does the patient resolve. So if you read the treatment aspect we used to study, ना, it's a self-limiting disease. 6 to 8 weeks में normal हो जाता है. तो 6 to 8 weeks तक तो वैसे ही disease चलेगा. So just because the patient was suffering for 3 weeks doesn't make you make it RPGN. RPGN is when the patient's clinical condition starts deteriorating. Full form क्या है? Rapidly progressing glomerulonephritis. And this is just a clinical term to be able to document it. What do you have to see under the microscope? You have to see crescents under the microscope. तो वैसा कुछ अगर history दिया होता, I would have also selected RPGN. But there should be a rapid deterioration. That doesn't mean कि creatinine 1.2 से 1.4 हो गया तो that is a rapid deterioration. No, some clinical history will be given. Creatinine will be markedly elevated. There will be a previous value of creatinine given, then a new value of creatinine given. So एक progression होना चाहिए ना. That is how you will mark it as rapidly progressive glomerulonephritis. One value of creatinine is not gonna make it rapidly progressing. कुछ rapid or progression word and sequence should be given in the question. So till the time crescent was not mentioned, I will still go in for a PSGN. ठीक है? Yeah, so the next thing, spike and dome pattern was also asked. So this I've told you, spike and dome, matlab I always used to tell you that when there is spike and dome, spike and dome, spike and dome, I used to say ये spike peak पे होता है and peak of the age पे होता है. Which is the one that happens in the elderly? Which is the one that happens in the elderly is MGN. So we had always studied this. It happens at the peak of the age, and it shows you the peak of the pattern. Very important. Okay, so on that note, आगे बढ़ते हैं. What is going to be the next question? Another very controversial question that we have. So इसमें तो मतलब अभी तक this तो I did not even discuss in the day before yesterday's recall because कोई मुझे कुछ बता ही नहीं रहा इस question का. मतलब everyone's telling me this question, but no, whatever I'm asking, they're saying नहीं ये भी नहीं था, ये भी नहीं था. So I'm still struggling with this question. But this much I've understood is everyone agreed to the photo on Telegram कि हाँ photo ऐसा ही था. This is something that was there in the picture, and they said that yeah, definitely it was a cardiac ka question tha, some myocarditis was there, and there were these orange cells. Everyone agrees with me कि orange cells थे, है ना, orange cells थे. ये तो हो गया. This you agree? तो orange cells थे, मतलब they were all eosinophils. They were dealing with the case of eosinophilic myocarditis. Eosinophilic myocarditis is what they were dealing with. अब now they, if you ask me कि eosinophilic myocarditis किस में होगा, तो eosinophilic lymphocytic में तो नहीं होगा, common sense. Pyogenic is to do with bacteria, means that is neutrophils, नहीं होगा. Ashoff and rheumatoid arthritis, or sorry, rheumatic heart fever, rheumatic heart disease. Rheumatic heart disease shows you Ashoff nodules. That will show you what cells? Those caterpillar cells. वो सब कुछ नहीं था. This is eosinophils. So eosinophils is going to tell me something towards some kind of a parasitic infection. So as of now, Chagas disease goes well. But then a controversy, why am I still not comfortable in this, is because eosinophils था तो Chagas disease. Some students are saying, ma'am, lymphocytes था. अब now lymphocytes में तो the answer will change. And अभी तक तो what students have told me on Telegram is this photo, but then again there is one school of thought that ये photo नहीं था. So there are these, actually total I've picked up 5 questions जो भी question mark चल रहे हैं, and I'm like trying to get answers from students कि ये 5 question जो इतना controversial question, and there's nothing controversial, मतलब you just need to give me a consensus कि मैम ये था, तो answer is in front of you. I'm giving you all options कि देखो ये photo था तो Chagas disease है, lymphocytes था तो lymphocytic है. Controversy कुछ नहीं है, but वो मुझे no one is giving me that consensus कि ये था. अभी I'm still struggling to get that consensus from the students. तो image तो यही था. Okay, one thing I've got, image तो यही है, तो फिर eosinophils है तो फिर eosinophils select करो, then you're going to select the parasitic infection, of course. Chagas disease, trypanosoma cruzi, of course, you know it can affect the heart, it can cause myocarditis. So again, my answer will depend on you saying yes. If you say yahi photo tha, then I'll say Chagas. If you say ye photo nahi tha, lymphocytes tha, then I'll change my answer to lymphocytic. So my purpose of solving these questions is that even if it is a controversy, at least I'm telling you going forward, INICET next year exam या जो भी exam है, उसके लिए क्या करना है. I mean, how should your approach be? You should be able to solve these questions. So knowing the question and answer is not important. Just knowing how to solve that is very, very important. अच्छा, then coming to another kidney question, which was the most 5-year-old बच्चा था किसका, ये जो myocarditis वाला, is this myocarditis wala bachcha is what you're talking? Okay, acha. So tell me one thing, this 5-year-old, I don't know, no one has told me, but now that you've told me it's a 5-year-old, let me ask you, by chance in the question, was there anything like Loeffler's endomyocarditis, or was there anything like fibroelastosis? ऐसा कुछ था? Loeffler's endomyocarditis नहीं था, because they also tend to show you, go back to your cardiac वाला chapter, I have taught you like Loeffler word तो जहाँ भी आ जाए, Loeffler's pneumonia, Loeffler's endomyocarditis, मतलब lots and lots of eosinophils happen, and that disease only classically happens in बच्चास. That is why I was asking, but अब वो options में ही नहीं था, तो parasitic infection is what you are going to select most commonly. ठीक है, चलो, going back, एक और kidney question था, which I'm coming back to, which was the most baby question ever, and that was these round laddus were asked. What is this? We all know what is this. I mean, पूरा kidney chapter पढ़ा, and they went back to the first slide and the most primitive question, and that was the glomeruli. ये कॉपी पेस्ट क्वेश्चन था, बिकॉज इफ यू सॉ द ऑप्शंस आल्सो, ऑप्शंस वर अनरिलेटेड. एक तरफ किडनी लिखा है, एक तरफ पैंक्रियाज लिखा है. बेसिकली अ सिमिलर क्वेश्चन केम इन द एफएमजी एग्जाम ना इन जनवरी, तो वो कॉपी पेस्ट हुआ. उसमें फोटो, बस फोटो चेंज हुआ. उसमें फोटो वाज ऑफ पायलट्स ऑफ लैंगरहैंस, तो द फोटो वाज डिफरेंट. ऑप्शंस देव केप्ट द सेम. देव जस्ट इंस्टेड ऑफ पुटिंग द पिक्चर ऑफ आईलिड्स, देव पुट द पिक्चर ऑफ ग्लोमेरुलाई. बट ये तो आई होप, आई फिंगर्स क्रॉस्ड, आई होप नो वन गॉट दिस रॉन्ग. Everyone's been able to attempt it, because इतना kidney का detailing we had done, and we can't go wrong at this stage, है ना. ठीक है, then the next question, there were many this big circles. हाँ, तो ठीक है, हो सकता है ज्यादा glomerulus दिया होगा, तो maybe they give you a lower par. This is their favorite thing to do, कि there were lower par photo दे दो, so that students get a little confused and they can't zoom in also. But हाँ, as long as there were these big laddus there, they were all glomeruli only. ठीक है. Now comes another obsession, the obsession of AULI and NBE. NBE का कुछ obsession ऐसा हो चुका है. So now we know alcohol, STD, vitamin deficiencies, and AULI appearance. This, so they are like obsessed to the core with all of that information. So AULI came twice in your Jan FMG exam. CMV again has come twice in this NEET PG also. So there was a child with hepatosplenomegaly with petechial rashes, and urine examination has shown owl eye appearance. So again, I don't even want to know the rest of the options, because as soon as you tell me owl eye appearance, I know for a fact that we're dealing with CMV. Also because CMV के लिए they say that the best sample is the urine washings. तो जल्दी से can you also revise with me? ये तो मतलब this was a giveaway question ना, giveaway question in the sense that owl eye appearance लिख दिया तो what more do I need in life? But can you tell me what is the antigen for CMV that is you are using, and what is the cell line for CMV which is the best? For INI CET you have to tell me that. So antigen is PP65, which is a very important microbiology question. No one studies this much because I'm telling you I'm going forward for INI CET, repeating PP65. And next is going to be cell line. So it is a human fibroblast cell line. Very good. So human fibroblast cell line, which is what cell line? Primary, secondary, or continuous? It is a secondary cell line. It is a secondary cell line, and that is what is said to be the best cell line for cytomegalovirus. ये अब going forward इसका question है, ठीक है? Then there was another question on cytomegalovirus which was to do with some calcification. कौन सा वाला calcification? उल्टा, let me ask you. CMV में कौन सा वाला calcification होगा? You're gonna see which calcification, guys? The periventricular calcification, exactly. So that was another question. So for some of them I have not even bothered asking you कि और options क्या थे, because some questions had very confusing options, but some questions had such straightforward hints that we really don't care about the options after that. It is evident कि अच्छा ये word लिखा था, owl eye लिखा था, तो देखो I don't want to know if measles was written or something else was written. If owl eye was written, I know it was CMV. If periventricular calcification was written, I know it was CMV. So now if you remember that बच्चे का photo that I keep drawing all the time when we are dealing with cytomegalovirus, I told you na, make a C like this and then make a cytomegalo, topi banao and beard banao, cytomegalovirus, because what all was there? So C and C. Pehle to this C will stand for number 1, cataract. Second, I told you that acha, it's looking like ears. So एक और eye C related thing, basically eye related thing, chorioretinitis. And then C से we can also have ear sensory neural hearing loss can occur. ये ears जैसा लग रहा है. M say I told you there can be microcephaly that these patients have, so that is also mentioned. There is mental retardation. And V will remind you of which calcification? Periventricular calcification. That is how we had learned this funny photo of cytomegalovirus. So CMV likho and then you get all the things together. So this congenital things were asked a lot. एक और congenital infection पूछा था. Which congenital infection was asked, guys? Ulta only I am asking you. Which congenital infection are we talking about? That प्यार में अंधा बहरा. What is प्यार में अंधा बहरा? If you remember this also, I don't know how many of you revised. End में तो there was no time to revise the full course. But प्यार में अंधा बहरा was प्यार मतलब there was patent ductus arteriosus. अंधा बहरा means अंधा is cataract and बहरा is sensory neural hearing loss. So प्यार में अंधा बहरा was crying for Bella. Bella is the girl for whom he is crying, and he's Pyar Mein Andha Behra for a girl called Bella. Okay, so Rona for Bella, Rubella. Rona for Bella, why? Because he is Pyar Mein Andha Behra. That is how we had learned it, right? So this was very classical triad that you had for rubella congenital. This thing infection. So though basically that pattern is like ongoing, that has been followed everywhere. Pick up one topic and हाथ धो के पीछे पड़ जाओ. So that is what they did for STD, and for vitamin deficiencies there were some 9-10 odd questions. STD, every question had alcohol in it, every question had STD in it. So there was an element of obsession that we saw in the examiner definitely this time also, and that is there. That is not something new, that is ongoing. वो काफी ज़्यादा obsession चल रहा है already. ठीक है. So now एक और obsession reminds me of this one very famous question. This obsession, I don't know when is it going to go. I think it got a little highlighted and removed, but I hope you can read it. Crumpled tissue paper appearance. This obsession is also not gonna go. This has been a hat trick this time. Crumpled tissue paper appearance, and they asked you the enzyme deficiency. So crumpled tissue paper appearance के लिए I'm talking about Gaucher's disease. Gaucher's disease के लिए, and yeah, later on students, abhi I was reading the telegram messages a while ago, and I realized that students have also told me that this question came with anemia and bone pain. Bone pain and anemia was also given in the question. So that also goes in favor because we always study na Gaucher's is gouge, ouch. Gaucher's is ouch. So ouch matlab these patients are going to have bone pain in it. Bone pain, osteopenia, X-ray pe Erlenmeyer flask deformity. So all that bone pain related history also goes well in favor of Gaucher's. Ab question में हो सकता है with glucocerebrosidase, there was galactosidase भी हो सकता है, alpha galactosidase, beta galactosidase, but I hope you remember Gaucher's has the U, so you won't select the galactosidase wala options, you will select the glucosidase wala options, you will select glucocerebrosidase. ठीक है. अच्छा, 4 images were given which was confusing. Pick the question from bony pains. हाँ तो अच्छा मतलब I did not get that. Was this a question with 4 images in the options? Was that the scenario? There were 4 images in the options. Yes. So in case that तो सिर्फ इमेज था या इमेज के साथ अच्छा क्वेश्चन हैड, तो either way बोन पेन से ही सिलेक्ट करना है. whatever option had bone pain going in favor with crumpled tissue paper appearance, that is what you had to select out there. ठीक है. चलो, but हाँ, at least the topic is clear that ये लोग they are pretty much obsessed, like to the core they are obsessed with this question. Another question which they are obsessed with is the next one that I'm asking you. Again, I'm not, for some question I really don't care about the options because कितनी बार ये question आ चुका है तो answer भी same है. And what is that? This is the radiological image of the putty kidney. The putty kidney का question also comes with sterile pyuria, and what is the answer going to be? The answer is going to be tuberculosis. So this came in the NEET PG 2 years ago also. This has come once again. This is a direct it very rarely happens कि as it is direct copy paste हो गया. But there are some nice examiners like us. सोचा होगा कि let's not be very mean to the students. So yeah, they have managed to send you that question across. So good for us. We need such questions in the paper where I feel कि when I'm going like एक गलत, दो गलत, तीन गलत, and suddenly such a question comes and my confidence comes back. I think it's a much needed. Another much needed question was photo nahi aaya tha. I know picture was not there. I'm only got a picture for reference. Question came with regard to another recent obsession. Measles के साथ अभी NBE का recent obsession हुआ है because January 2020 में the question came on the 3 C's of measles. Cough, coryza, conjunctivitis. Cough, coryza, conjunctivitis. 3 C's had come in the Jan 2023 का FMG exam. अभी recently 3 C's had come, and now the NEET PG exam has got you Koplik spots with rash. So again, the recent most obsession. So maybe in the next exam they will give you what is the vaccine strain of measles. क्या होता है guys? Which vaccine strain of measles are we talking about? कौन सा स्ट्रेन होता है? तो यू विल टेल मी द स्ट्रेन ऑफ मीजल्स, मम्स एंड रूबेला. चलो एक जल्दी से टेस्ट करते हैं. मीजल्स तो पता है, मीजल्स, मम्स एंड रूबेला में 3 चीजें बताओ. फर्स्ट यू आर गोइंग टू टेल मी देयर incubation periods, then you're going to tell me their vaccine strains, then you're going to tell me their vaccine strains. So let's get going. When I talk about measles, mumps and rubella, so measles starts with what? It starts with 10 days. 10 days में measles is what is going to start. फिर 10 का क्या बनाओगे? 10 का बनाओगे 19. So mumps is going to be 19 days. And 19 का फिर आगे जाके क्या बनाएंगे? We will make a 4. So that is going to be 14 days for rubella. ठीक है, रिपीटिंग वंस अगेन, दैट इज मीजल्स, मम्स, रूबेला 10, 19 एंड 14. यहाँ तक ठीक हो गया एवरीवन? द इंक्यूबेशन पीरियड्स आर ओके. नाउ वी गो टू वैक्सीन स्ट्रेन. व्हेन आई से द वर्ड मीजल्स, when we say measles, it sounds like Z, na? Measles. So there's going to be Zagreb strain. Zagreb strain means Edmonston Zagreb strain. There is Edmonston Zagreb strain, number 1. Then when we say mumps, if you all remember, mumps का जो बच्चा होता है, it's a छोटा सा cute little बच्चा with very chubby cheeks. Actually not chubby cheeks, but he's got bilateral parotitis. Bilateral parotid gland होता है ना, तो ऐसा बच्चा का ऐसे chubby chubby cheeks, very cute बच्चा. So cute बच्चा named Jerry. Jerry Lynn. There is excellent. There is Jerry Lynn is the strain that you have. So again, like I said, cute bacha Jerry, that is going to be mumps. And rubella ka to R for R, RA27/3. So again, that is going to be rubella. So these are the three things that you have to know. Now tell me, they are not of the same family, although we have measles, mumps, rubella ka MMR ka vaccine, but families inka alag alag hai. Can you tell me the family of measles and mumps? Which family do they come under? Family of viruses. Okay, you say paramyxoviridae, theek hai, but rubella doesn't come under paramyxoviridae family. Rubella comes under which family? Earlier it was said togaviridae. That is I want to tell you. पहले togaviridae था. Now that has changed. अभी इनका ही favorite time pass है. इधर से उधर family name change करते रहो. Microbiology में ये सबसे favorite time pass है. Now it is said to be a part of the Metona-Viridae family. So like I said, it's their favorite time pass. Metona-Viridae family. तो अब जो rubella था, the name of that girl Bella has now changed to Metona. So it is the Metona-Viridae family. हाँ, name change is इनका favorite. Like few years ago, जो वो fungus है Penicillium marnefi, they changed it to Talaromyces marnefi. इनका favorite time pass यही है. इधर से उधर कुछ name change करते रहो, then your literature keeps getting bulkier and bulkier. Okay, so yeah, these were again measles wala question ho gaya. Let's get back. Where were we? How can I forget this question? This was the question which we studied like 72 or 48 hours before the paper. Yeah, 48 hours before we studied. So ye wala question to is something which has God gifted to all of us. That is someone who was being asked about one of the agglutination tests. Do you remember like जो YouTube पे session हुआ था उसमें last में we had done cat sat on a mat and I had told you कि बस पूरा immunology में से यही कर जाओ. Only God knows that why did I say that. Honestly, sometimes you know before the exam, we ourselves have these palpitations कि you know what topic to select for the students because the course is so vast and then you have to select. Students come to you and say मैम 5 मिनट में immunity पढ़ना है. So 5 मिनट में immunity कौन पढ़ सकता है? But you can't tell the student कि देखो 5 मिनट में immunity नहीं हो सकता है because that student is already so tensed for the exam. And if you end up telling the student that listen, no one on this planet can do 5 minutes में immunity, so be a little realistic. That student will ऐसा टप आंसू टाइप will start crying. So you have to be कि नहीं 5 minutes में भी immunity हो सकता है. Why not? It is possible. You have to be very positive. But internally you are also having those palpitations that अरे यार what can someone do in 5 minutes? But yeah, this is exactly what happened with me. Just 2-3 days before the exam, and all of you were like मैम immunology पढ़ना है, ऐसा 2-3 स्लाइड में पढ़ा दो. And then I was wondering कि क्या 2-3 स्लाइड कैसे, like humanly कैसे possible है कि 2-3 स्लाइड में immunology पढ़ा दो. But then it was actually like asking God for help. I was just sitting, closed my eyes and I was sitting कि क्या ऐसा 3 topic पढ़ाना है. So I remember we did those precipitation reactions, those famous single diffusion, double diffusion wala, that crappy thing that we have. And the second we did were agglutination. And then I just prayed to God कि इन्हें और मुझे दोनों को बचा लेना. But that is all that I did for immunology, and we were very lucky is all I can say, that out of those 2 slides that we did for immunology, one thing came as the question. So that way I think God genuinely was on our side and was favoring us, looking at all the hard work that all of us put in. So God was wanted to reward us कि ठीक है जो 5 minutes immunity पढ़ा था, I will give a question from that only. So cat sat on a mat was all the agglutination test. This was the cold agglutination test. This was the standard agglutination test, and it was the microscopic agglutination test. ठीक है? And what is this cat sat on a mat? तो cat के बारे में बात था. तो my billy is how we had learnt it. My for mycoplasma. So the cold agglutination test is in mycoplasma. Standard agglutination test is for brucellosis, and microscopic agglutination test is for leptospira. है ना? And over here they had exactly leptospira का कुछ तो आएगा. So we had learned leptospira as RRRR. Do you remember I used to write leptospira as दो चीजें. We used to say leptospira is number 1 leptospira. तो lots of Ras RRR which I'll tell you. And lepto I had told you ये कैसा दिखता है. It's spiral तो ठीक है, but it's लपेटा हुआ. लपेटा हुआ means it's a hooked ends. It's not a straight spiral like this. No, it's gonna be lapeta hua with hooked end. So lapeta hua for lepto and spira for RRR, because we used to say that rat urine is going to contaminate rainy water, and that rainy water is going to then come in contact with the rice field workers. rice field workers are going to, because rainy water is used for rice na, rice growth, so rainy water is used by rice field workers. And एक ring दिखता है, कौन सा वाला ring? This also we had done very close to the exam. So that was what? The Dinger's ring. So I told you rat urine contaminating rainy water, rice field workers, Dinger's ring. So over here, instead of giving rainy water and rice field workers, they gave you the sewerage wala workers. And yes, it presents with very famous, there is conjunctival redness and headache. So leptospira ka history was the classical, and they asked you the test, which was obviously the माइक्रोस्कोपिक एग्लूटिनेशन टेस्ट. ठीक है, तो अब बाकी बाकी भी जल्दी जल्दी बता दो. व्हाट इज द पॉल बनल टेस्ट? नो वन डज इट नाउ डेज, बट इट्स वेरी फेमस विद द एग्जामिनर. पॉल बनल इज डन फॉर infectious mononucleosis, मतलब एप्स्टीन बार वायरस. व्हील फेलिक्स टेस्ट इज समथिंग which is done for rickettsial infections. So rickettsial में if you remember the वही जो था कौन सा, यूजिंग व्हाट बैक्टीरिया, इट इज डन फॉर द डायग्नोसिस ऑफ रिकेट्शिया, बट डू यूजिंग व्हाट बैक्टीरिया? दैट OX2, OX19, OXK, प्रोटियस वाले स्ट्रेन्स के साथ. वेरी गुड. एंड विडाल तो आई थिंक एवरीवन नोज, इट इज डन फॉर सैल्मोनेला और टाइफॉइड फीवर, टाइफी, पैराटाइफी. सो विडाल टेस्ट तो बिल्कुल ही डिफरेंट है. सो द अदर टेस्ट वर नॉट मेकिंग एनी सेंस, ओनली it was a clear cut case of microscopic agglutination test. Let's come to the next question, which was another unnecessary controversy. Fourth option again doubtful hai, but students later on told me कि anthracosis ही था. I hope these were the four options. What was the doubt in it? Firstly, there was this created a lot of a lot of hue and cry कि smoking का भी history था, and cement industry is also what they were mentioning. So see, first and foremost, when I'm talking about the cement industry, what are the things out of this that I can think of? Cement industry में silicosis का भी association होगा, asbestosis का भी होगा. asbestosis का थोड़ा ज़्यादा exposure होगा. I always believe if nothing was mentioned, then also my answer would have been asbestosis, because this is more exposed, or more exposure to asbestos happens in the cement industry. But even if there was a confusion, there was one sentence written which was the giveaway. Mesothelioma is diagnosed. Come on, mesothelioma किसका specific tumor है? Mesothelioma is going to be seen with asbestosis. There is no doubt about it. Silicosis हो या siderosis हो या anthracosis carbon हो, it has no association. Asbestos had two questions which were very classical. The most common tumor with asbestosis was adenocarcinoma. The most common was adenocarcinoma, and the most specific tumor that you had was mesothelioma. There was no doubt about this at all. So please remember, asbestosis, मीजोथीलियोमा लिखा था तो सीमेंट इंडस्ट्री हो या कोई भी इंडस्ट्री हो, मीजोथीलियोमा था तो asbestosis. Now going forward in the exam, what are the questions for mesothelioma? See, one question on mesothelioma will always come, and I personally feel that if you're targeting INI, CET or FMG June exam, तो अब देखो asbestos वाला question has become way too monotonous and घिसा पिटा type, and they have asked you a million times. और क्या पूछ सकते हैं? They can ask you, is there any virus associated with mesothelioma? So what is that DNA virus that has been associated with mesothelioma now? SV40. SV40 is a DNA virus, and there is no other disease known to humans other than mesothelioma with SV40. मतलब virology के chapter में जाओ, SV40 dash causes mesothelioma, chapter खत्म. That is how it is. SV40 only causes one problem, that is mesothelioma. बस उतना याद रखना है. Other than that, one very recent event is, what is the marker positive in mesothelioma? This is important not for FMG. Yeah, INI CET के लिए important है. The marker for mesothelioma is going to be calretinine. But let me tell the FMG students that अपना January वाला exam also, if you see that that what can I say, that division of FMG versus NEET is almost going away. It is like a very minor 5% of a difference that is left, I believe now. 5-10% रह गया है, बाकी almost FMG NEET same चल गया. So please now you will have to read a little bit extra, because it's no longer that one line situation जो होता था. ठीक है, moving on to another question that we have. There's a 5-year-old child with bleeding per rectum, rectal polyp. यहाँ तक का जो question था, that was a clear-cut NEET PG 2019 repeat. The only difference is in NEET PG 2019 they gave an image along with it, and this time they did not. And they said there was large glands with colonic epithelium and mucin. तो सबसे पहले many students got this and got a little confused. But अगर सिर्फ इतना पढ़ते, 5-year-old child with bleeding per rectum, can you tell me the clinical diagnosis? What is a 5-year-old child with bleeding per rectum? 5-year-old juvenile rectal polyp. Juvenile rectal polyp comes under what family of polyps? It comes under hamartomatous polyp. यहाँ तक question था तो it was hamartoma. But as soon as they wrote all of this, everyone said नहीं नहीं, now तो it must be adenoma. If you all remember, I used to there was along with inflammatory cells also. ठीक है, inflammatory cells भी अगर था, that doesn't change my answer. But now many students marked adenoma saying कि ma'am large glands were written. अरे large glands तो होगा, large, see size of the glands. Firstly tell me that adenoma anywhere in the GIT, starting from the esophagus, stomach, small intestine, large intestine, anywhere in the intestine or GIT, when I use the word adenoma, it means it is a pre-neoplastic condition. It is pre-malignant. तो कुछ तो pre-cancerous लिखा होता ना. They would have written some large cells are seen, some pleomorphic cells are seen, maybe mitosis is seen, the nucleus is hyperchromatic. कुछ ऐसा bad description तो होता ना. They just said there are large glands. अब size के basis पर तो you won't say ना cancer है, pre-cancer है या नहीं है. So size is never the criteria in all of this. Some bad looking cells, pleomorphic cells, dark nucleus, large nucleus. ऐसा कुछ dangerous words would have been written. One that was not written, तो adenoma नहीं है. Secondly, why do you want a 5-year-old kid to suffer from adenoma? Adenoma occurs, precancerous things happen, slightly older people. That is not happening. Second, carcinoma भी नहीं हो सकता. There is no bad description given. And then corystoma. Why corystoma? Corystoma is chori ka tumor. You are dealing with the colorectal region and it is showing you the colorectal epithelium. So why do you want to deal with the corystoma? Corystoma is chori ka tissue, means some pancreatic tissue would have been here or some gastric tissue would have been here. Then I would have thought of corystoma, but that is not happening. As long as, see, why do they say colonic epithelium? Because now go back and go to the NEET PG 2019 question. What is the microscopic examination of juvenile rectal polyp? It is cystically dilated glands. So you are telling me ना कि मैम बड़े glands लिखे थे, large glands were written, because normal glands only tend to become very dilated. They are cystically dilated glands with a lot of mucin, and because of that mucin they tend to call it colonic epithelium or mucin wala epithelium. But yeah, this still remains a hamartomatous polyp. Again, something not a new question, because I remember, I don't know how many of you remember this from our main course. I used to say na that on the last day when you will come to me and say कि ma'am intestine पढ़ना है या GIT पढ़ना है, I have 5 minutes to study GIT. What question did I tell you कि पढ़ के जाना hamartomatous polyps? Because if an examiner is making a balanced paper, he will give you a question on hamartomatous polyps. It's a must that he will give that to you. Okay, coming to another question which we had shouted out a million times in our classes, PCP wala question, and I told you there are 4 PCPs that you have to consider out here. So firstly, you had an HIV positive person and the stain used was the Gomori methenamine silver stain, which showed you this crushed ping pong nahi likha tha. I know this, I have added, but they had written crescent like structures. Crescent like मतलब वही हो गया ना, पिचका हुआ crushed ping pong ball. So that crushed ping pong ball means pneumocystis carinii pneumonia and all the other things that were there, just in case that crescent and ping pong did not strike you. They told you Bal was non-cultivable. Firstly, Pneumocystis carinii is non-cultivable. It does not happen to have any culture media. Secondly, the stain for Pneumocystis carinii is Gomori methenamine silver stain. Thirdly, it is an opportunistic infection, HIV, which occurs at a CD4 count of less than 200. So, matlab, everything in the question other than this was also pointing towards Pneumocystis jirovecii or Pneumocystis carinii pneumonia. Now, going forward, can you tell me what are the 4 times PCP? Abhi, the same question will come in INI also. देखो, way ahead of time I am giving you a prediction. ये same question वहाँ भी copy paste कहीं ना कहीं से होगा. So whenever they will try to tell you about pneumocystis carinii pneumonia, whenever they will try to tell you about pneumocystis carinii pneumonia, you will now think of what else? What cells are going to be seen? What cells are going to be seen is plasma cell pneumonia. So this will show you lots and lots of plasma cells. So I can call it PCP, plasma cell pneumonia. Right now it told me it shows you the crushed ping pong ball appearance. The crushed ping pong ball appearance. Done. And finally, if they ask you the treatment, so they say कि जो pneumocystis pneumonia है, pneumocystis का drug of choice बताओ या treatment बताओ. So the first drug that you will think of is cotrimoxazole. The first drug you will think of is cotrimoxazole, and the other drug that you're going to think of is pentamidine. The other drug is, for severe cases, pentamidine. Yes. सॉर्टेड। तो देखो एवरीथिंग पीसीपी पीसीपी पीसीपी, 4 बार पीसीपी करा, चैप्टर खत्म हो गया। दैट इज व्हाट आई प्रिडिक्ट एंड दैट इज व्हाट यू विल सी एज वन ऑफ माय फ्यूचर इंस्टाग्राम पोस्ट्स आल्सो। अच्छा डॉक्टर अभिजीत, व्हाई ट्राइकोमोनास इज कल्टिवेबल? इट्स नॉट दैट ऑल प्रोटोजोआस आर नॉन कल्टिवेबल, ऐसा कैसे? सो बताओ, एंटमीबा हिस्टोलिटिका का डायमंड मीडिया होता है, ट्राइकोमोनास का भी डायमंड मीडिया होता है। इट इज नॉट। सो सी व्हाट दे डू इज यू कैन ऐड सम सप्लीमेंट्स एंड मेक देम ग्रो। एवरी प्रोटोजोआ इज नॉट नॉन कल्टिवेबल, ऐसा नहीं होता। एंड ट्राइकोमोनास, डू यू रिमेंबर दैट स्टोरी ऑफ ट्राइकोमोनास एंड दैट फैंसी आंटी दैट आई टोल्ड यू कि फैंसी आंटी लव्स डायमंड्स? Trichomonas was that fancy auntie, na? So she used to love diamonds, and diamond media is what you can grow trichomonas on. So of course it's growable or cultivable. ठीक है, now next question came on this. This was another, I always used to, if you remember, वो जो 18th February वाला हमारा crash course हुआ था, in that I was shouting out के ये वाला जो question है, ये हमेशा ये दो photos में confusion होगा, and दोनों photos came in the paper. One photo का question I've got, the other I have not, but I know कि दोनों आया था. One was this, the big dot and the small dot. I told you कि macrophage के अंदर दो चीजें होता है. Macrophage के अंदर either you will get काला आजार basically means LD bodies, or you're going to get a fungus, and that fungus is going to be histoplasmosis. So these are the two things that I was telling you about. So दोनों questions came in the paper. Kala Azar wala LD body came, in which they gave you a Rajasthan resident with ulcer. So basically they gave you cutaneous leishmaniasis, and they had written something like kinetoplasticine. And many students told me photo nahi aaya tha, but kinetoplast word was written. So that is even better for us. Photo na aaye to even better, because photo identify karna becomes a little difficult. But otherwise, just going by the kinetoplast word, I think everyone would be able to identify that LD body hai. And this is something which is called, cutaneous wala is caused by Leishmania tropica, which is known as the Aleppo button. Aleppo button, or this is also known as the Delhi boil. This is also known as the Delhi boil. So this is basically the cutaneous manifestation of Leishmania. Kinetoplast word was the giveaway over here. Very, very, very important part. ठीक है. Now there's another thing. There was a question on this, which सबने मुझे कह दिया हिस्टोप्लाज्मा था, but maybe because you got too excited looking at the picture, but no one told me हिस्टोप्लाज्मा का क्या था. If you scan through 2,000-3,000 messages of my Telegram group, you will realize because everyone is saying, "Ma'am, histo पे question था, histo पे question था." Histo पे क्या question था? No one told me, but at least I got you the picture. तो history था. So yeah, what exactly was that? That I don't know, but सबको बस ये था कि हाँ हमने mark कर दिया मैम था तो histoplasma. Pulmonary involvement was there, which is okay because all dimorphic fungi tend to show you, histoplasma is a dimorphic fungus, na? So all dimorphic fungi should tend to show you pulmonary involvement, which is much expected. And of course this picture, see again macrophage ke andar single dot, this is of course going to be histoplasmosis. And remember I had again shouted out a few days back only that histoplasma is TB ka cousin brother. So TB ka cousin brother is of course going to be histoplasma, and histoplasma occurs inside macrophages. Okay, the CD4 count was less than 200, so maybe this was also an HIV positive person, pretty much possible. Yes. Okay, so if that was the case scenario, as long as the picture was this, so this was sorted. Picture ये था तो और कोई doubt ही नहीं है. This is the yeast form of histoplasma, very tiny yeast form. It's only measures 2 to 4 microns. छोटा dots होता है. That is what is histoplasma capsulatum. ठीक है, shall we move forward? There was another question related to parasitology, which was HRP2 antigen testing. So the card was not given. Card I have just got you for reference. It was a text question, that is HRP2. Firstly, what is HRP2? HRP2 is histidine-rich protein. It was histidine-rich protein 2, and this is of course seen in a case of Plasmodium falciparum. So please remember that all the malaria species that you ever think of on this planet, Vivax, Falciparum, Malariae, Ovale, Knowlesi, कोई भी वाला malaria हो, all of them, they are going to show you AL for aldolase. All of them will show AL for aldolase. And what is the other L that you have? The other L is going to be LDH. सबके अंदर कौन सा antigen होता है? Aldolase is there, LDH is there. So all the malaria species have it, but Plasmodium falciparum, which is different, हर चीज में different है. It also tends to show you which malaria? Cerebral malaria. That has a special protein. See, that also has aldolase and LDH. When I say all malarias have aldolase and LDH, मतलब falciparum also has aldolase and LDH. There is no doubt about it. But falciparum has something extra, and that extra is going to be histidine rich protein 2, HRP2, which is going to be present. Okay, so this is a simple question, and that is the basis of this card test. Guys, going forward for INICET, what is the principle of every card test on this planet, be it for malaria or be it for HIV or hepatitis or COVID or urine pregnancy test, कोई भी card test होगा, it is based on immunochromatography. That is also a NEET PG question, and remember it for INICET. It is going to be what? It is going to be, principle is going to be immunochromatography. And every time, what is the first line that has to come positive? कौन सा line होता है that has to come positive? Control line. So control line मतलब thumbs up. It's not a bad thing. Control line होना मतलब test is valid. Valid है, ये valid है, ये valid है. यहाँ control line नहीं है, I won't read it. This is invalid. यहाँ भी control line is coming very, very weak. Other lines are coming, I don't care. Control line is not coming, something has gone wrong. Don't read that test. Do a fresh test. So wherever control line is coming, that is valid. Now यहाँ these three I will give the diagnosis. Here there is no line, मतलब this patient is negative for malaria. Here there is a line in the pan only, pan malaria. All malaria are there, but which it all मतलब वाइवैक्स भी हो सकता है, ओवेल भी हो सकता है, मलेरिया भी हो सकता है, नोलेसी भी हो सकता है, बट क्या नहीं है, falciparum में लाइन नहीं आया. So this is all malaria positive, but one thing I know that falciparum is negative. कोई भी मलेरिया है बट falciparum नहीं है. Whereas over here pan malaria is also positive, falciparum is also positive. मतलब this could be either a case of falciparum, or if it is not falciparum, then what else? मैम falciparum तो पक्का है, falciparum के आगे लाइन है, falciparum तो पक्का है, but what else? Maybe it is a mixture, falciparum and vivax का combination है. Maybe it's a mixed infection. That could also be a possibility. That is why, do you remember when we were doing the main course of Path Micro Punch में, I used to give you that funny story that in the end malaria में you have to make me very very rich. मतलब pathologist और microbiologist का earning season होता है malaria, because no one can give you the exact diagnosis except someone looking at the microscope. So I used to say, let me make some money. So if anyone asks you what is the gold standard for malaria, जैसे यहाँ mixed infection है या falciparum है, पता नहीं, तो what will you do? You will give me some money. You will say, ma'am, can you see the slide and tell me? Ultimately, the gold standard for malaria is going to be microscopy. So remember, I used to say, always make me very, very rich in the malaria season. So हमेशा याद रखना, wherever confusion, gold standard is always microscopy. This is just a rapid method of giving the diagnosis. Card tests are rapid ना, तो वो होता है. That is it. But ultimately, gold standard, patho या micro, मतलब someone with a microscope is your gold standard. Chalo, coming to the next, cancer associated with HIV positive patient. This time they've gone leaps and bounds and picked up images from the New England Journal of Medicine. New England Journal of Medicine का impact factor देखो, it's one of the highest impact factors. मतलब journal भी वो उठाया जो सबसे high-fi journal of the country and of the world है. So that is what they picked up, and this was a picture. So they tried to give you something very very fancy by scaring you with a picture that no one has ever seen. But ultimately अगर question ध्यान से पढ़ते, so firstly, this was bad spelling, but yeah, this was cancer that was there, cancer associated with HIV positive person. Photo bhi bhul jao for a moment. Can you tell me what is the cancer associated with HIV positive person? Most common cancer kaun sa hota hai? It is a non-Hodgkin's lymphoma, but non-Hodgkin's lymphoma was not there in the options. It was Kaposi squamous. Some people told me basal cell and malignant melanoma were also there. Basically, lymphoma wala koi word hi nahi tha. ठीक है, then I can't select. What is the second most common cancer that we have with HIV positive persons? That is going to be Kaposi sarcoma. And was Kaposi sarcoma there in the options? Yes, it was. So Kaposi sarcoma agar tha, then I mark that. And if I look at the overall color of this lesion, it is looking a little reddish, because I know Kaposi sarcoma is a red lesion. But Kaposi sarcoma का most common site क्या होता है? What is the most common site? That is what is unusual. The most common site is the lower limb. It's lower limb, or basically the cutaneous, the skin of the thighs, the skin of the lower limbs, है ना? And the second most common site is a lymph node. The second most common site is a lymph node. Having a Kaposi sarcoma in, तभी तो it was published in the New England Journal of Medicine. ये भूल भी जाओ, because otherwise you will start learning this aspect also. You don't have to know कौन से journal में था ये, but at least this is that was published. है ना, rare case होगा. Rare cases are published in journals and in literature. but rare हो सकता है, because once a patient becomes HIV positive, then anything can happen anywhere in the body. Then Kaposi sarcoma can happen from brain to toe anywhere, because it's an HIV positive person. Then all these sites and all become irrelevant because patient is immunocompromised. So image was just to make you a little scared, which I think you did get a little scared, but थोड़ा सा calm mind से सोचा होता, cancer and HIV यही दो options है. And if they would have changed it into genital cancer associated with HIV, then which infection comes to your mind? Most common genital cancer, cervical cancer हो जाएगा. Why? Because most common, yes, HPV infection related मतलब cervical cancer. So the question was very straightforward. सिर्फ first time I realized image was there to actually deviate you rather than getting you on the right path. Coming to the next question, there was an ulcer, pain less wala story was given, and I told you ye less wala story is always important. So what is that less story? It was everything less. There was a pain less ulcer with a pain less inguinal lymphadenopathy. It was definitely syphilis, right? This was clear cut. इसमें कोई doubt नहीं आया होगा. I hope you could remember syphilis. Everything was pain less. ठीक है? तो ये I'm skipping now because इसमें तो there is nothing more that I can tell you. Of course, when they were talking about ulcer and inguinal lymph node, they must be talking about that primary syphilis वाला stage, but all that was not asked. ये तो सिर्फ less वाला story था, very simple. अच्छा, then there was a question which was to do with the rotavirus. I did get other options. Some people said light microscopy with her. Some people said antibody was also there, and one more option was there. So either ways, rotavirus के लिए अगर diagnosis करना है, whether rotavirus was written or reoviridae was written, both of them are the same family. ठीक है, rotavirus, reoviridae same. Basically, it causes diarrhea in infants. It is one of the most common causing diarrhea causes in infants, right? And how do you do the diagnosis? It is by viral antigen in stool. Only this was written. Viral antigen in stool was there. ELISA is, I am telling you कि antigen antibody testing के लिए हम हमेशा ELISA use करते हैं. For your future exam you should be knowing. But what was there in the question this time was viral antigen in the stool, and that is the next step that you will do. Antibody role नहीं होता इतना for rotavirus. Antigen is always more important. Light microscopy तो हो ही नहीं सकता, because do you see viruses on light microscopy? If you remember, for viruses I always used to show you that black and white photo देखते थे. Basically viruses are not seen. They are not seen on light microscope. Viruses are seen on electron microscope. So this can never be, I can never look at light microscope and give the diagnosis of rotavirus के लिए antigen testing ही करना होगा. Why in the stool? Because this causes diarrhea. Okay, someone said satellitism भी था. Yes, Dr. Kumari, I'm coming exactly to that. बस एक दो questions और रह गए. जल्दी let's wrap up those. Again, some people initially on Telegram everyone told me satellitism था. Maybe photo नहीं था या जो भी. But then when I had the recall session day before yesterday on YouTube, then students said कि मैम satellitism तो word ही नहीं था. So then again I got confused because Telegram पे तो everyone was very confident कि satellitism था पक्का था. But YouTube पे then when on live chat everyone said ma'am word was not there. So but still I believe maybe that maybe we've not recalled the exact correct option, but answer Haemophilus influenza ही है, and I'll tell you why. You had a young child with meningitis, pyogenic meningitis, because there is low sugar and high WBC, and they said there is a gram negative bacilli which was pleomorphic. देखो, अब एक तो meningitis था. Many students said that ma'am why didn't you think of Neisseria meningitidis? Firstly, Neisseria meningitidis is a cocci. ग्राम नेगेटिव तो है, बट इट इज अ कोकाई. सो फर्स्टली दिस इज वन थिंग. यहाँ पे बैसिलाई लिखा था, तो ये तो नहीं है. ग्राम नेगेटिव बैसिलाई में मेनी पीपल वर आस्किंग मी व्हाई नॉट अदर, लाइक व्हाई नॉट क्लेब्सिएला, व्हाई नॉट ई कोलाई, बिकॉज दिस वन मोर वर्ड वाज रिटन. प्लियोमॉर्फिक ऑर्गेनिज्म वाज रिटन. अब प्लियोमॉर्फिक तो हीमोफिलस ही होता है. gram negative bacillus which is also pleomorphic is going to be Haemophilus influenza. That is how I came to my answer. And then they asked you the culture characteristics. So we know that Haemophilus influenza shows you satellitism. Haemophilus influenza shows you satellitism, and for satellitism you have to have which? What is that streak that you have? What is that streak that you have in the center? This streak over here in the center is of Staph aureus, because we know very simple. Okay, now this is what I'm telling you for your INI-CET. What do we know for Staph aureus? Staph aureus causes narrow zone of hemolysis. It is going to break the blood. It is going to cause narrow zone of hemolysis. तो यहाँ narrow this much area around it, it is going to break the blood, this much area. Why do you want to break the blood? Because when the RBCs will break down, there is going to be factor 5 and 10 that will be released. Factor 5 and 10 release hoga. Hemophilus influenza needs factor 5 and 10. That is why once it starts getting factor 5 and 10, it will like a satellite, it will grow here. यहाँ जहाँ पे factor 5 10 मिल रहा है वहाँ it will grow. So that is why you call it satellitism, and that is what you had over here. I think students, you can also confirm to me. Many people in the YouTube session were telling me कि ma'am McConkey agar was also there, but McConkey agar में hemophilus does not grow on McConkey agar. So again, it either had to be a blood agar or a chocolate agar. Either of the two had to be there. This is not associated with McConkey and lactose and all of that. So या तो blood agar था, या chocolate agar था, या satellitism था. These are the only options possible that they would have given you over there. ठीक है, everyone's okay. देन अच्छा, वन मोर थिंग, मैकॉन्की ही था, बट मैकॉन्की आंसर नहीं होगा, ऑप्शंस में था, ठीक है रहने दो, बट मैकॉन्की वाज डिफरेंट ऑप्शन इन दिस क्वेश्चन ओनली. डॉक्टर पूजा, वाज दैट अ डिफरेंट क्वेश्चन ओनली ऑल टुगेदर? इसी में मैकॉन्की लिखा था या वाज दैट लाइक समवेयर एल्स? इसी में था, ठीक है होने दो. लेट मैकॉन्की agar be a separate option. We don't care about it because hemophilus influenza is not going to grow on a मैकॉन्की, है ना. लेट दैट ऑप्शन बी. ठीक है, वन मोर थिंग विच इज अ स्ट्रेट वन लाइनर. गोनोकोकाई के ऊपर क्वेश्चन था, नाइसीरिया, गोनोरिया, एंड आई थिंक दे आस्क्ड यू द ड्रग ऑफ चॉइस. दैट तो यू कैन टेल मी एज इट इज ओनली. उसके लिए वी डोंट नीड अ क्वेश्चन. टू मोर क्वेश्चंस क्विकली लेफ्ट. व्हाट इज द ड्रग ऑफ चॉइस फॉर गोनोकोकाई और नाइसीरिया, गोनोरिया? सेफ्ट्रियाक्सोन. तो that was again a question that was there over there. और भी options थे तो बता दो. और was this not the question because STDs and all? हाँ, kids के ऊपर also there were a lot of questions. STD तो मतलब इनका favorite हो गया, and there is no doubt about it. Non-lactose fermenting on McConkey. Acha, was एक second. Let me get back to that question. Did they mention this? Regarding this question, Dr. Pooja? यहाँ पे लिखा था non-lactose fermenter. So this तो I agree. कि non-lactose fermenter है on McConkey. But if I had to select the best answer in that scenario, वो satellitism तो इसका best answer होगा. After that, because if it is a non-lactose fermenter, it's a kind of a negative finding. Na? Negative finding is not something that I would go in for more commonly. Acha, filaria question. Yeah, that was another one that was there. I had that written. I don't know why did it not show up. Just give me a second. Filaria wala question I had put up in the... Just hang on. I don't know where has it gone. Filaria, and there was something on next step. Kya karoge na? Oh God, it has just vanished somewhere. But yeah, filaria mein, what is the next step that you are going to do? Just hang on. God knows, it has gone somewhere. So there were options given. Ab now, till day before yesterday, so everyone told me options were peripheral smear and DEC provocation test, but no one told me of the ultrasound. Was ultrasound scrotum given by any chance? I'll write it again. I don't know where that slide has only gone off in the PDF. So yeah, there was someone who had come to you with filaria antigen positive. If filaria antigen is positive, तो अब आगे क्या कर सकते हो? I think the options given were either a peripheral smear, second option was DEC provocation test, third option was now you're telling me ultrasound scrotum था, fourth option अभी भी नहीं मिला. तो again, I don't know what the fourth option was. So see guys, if there are two ways of assessing this, microscopy तो वही हो गया ना, peripheral smear. So there must have been something different in the fourth option that we are yet to recall. But tell me, filarial antigen अगर आ चुका है, now see, I have proved के filaria तो है, so this is done. So if ultrasound scrotum would not have been given, if I had to select between these two, I would have said that okay, let me look at it under the microscope, let me first do DEC provocation test, and then I will look at it under the microscope and find out the peripheral smear. But if DEC तब करोगे when ultrasound is not given. If ultrasound, this you will have to confirm to me. अगर ultrasound scrotum दिया था, then this is what you'll do. Why? Because how many times do you want to see the file area? Antigen तो मिल गया ना, तो बार बार file area देख के क्या ऐसा kick मिल रहा है life में? तो file area antigen तो you've seen. Now you have to go ahead with the radiology and start the treatment of the patient. So once you have seen the filaria in some form, be it the antigen or the PS or after a DEC test, then go on to the next modality. But if ultrasound scrotum was not there in the options, then my answer would be DEC provocation test. See, I am telling you all possibilities. कैसा था तो ऐसा answer, वैसा था तो वैसा answer. But yeah, I think many students after like yesterday only I got this update कि ma'am ultrasound was there in the options. So if ultrasound was there in the options, then ultrasound scrotum will be a better option in comparison to DEC provocation test. ठीक है. So this question is also sorted. तो total as I said ना, there are 5 questions जिसका भी plus minus चल रहा है. को AIHA वाला question, एक ये वाला question. Hemophilus तो you guys have sorted it for me. If malaria antigen was not mentioned, if only clinical था, then of course you will go ahead with DEC provocation test undoubtedly. पहले तो you will have to have a hint ना कि filaria है, then you will go ahead with radiology. So of course DEC provocation test. बट यहाँ पे फाइलेरिया एंटीजन वाज गिवन पॉजिटिव, तो अब वही ना, एज आई सेड, बार बार फाइलेरिया देख के कुछ पता नहीं लगेगा. यू रोट इन यूट्यूब सेशन, आई डोंट नो, मे बी आई मिस्ड इट. यूट्यूब सेशन हैड लाइक 600-700 स्टूडेंट्स, तो कई बार it becomes a little difficult to keep a track of the comments. I'm sorry, I must have missed it out. And the antigen positive to everyone told me, but no one told me कि options में ultrasound scrotum was also there. वो एक, if antigen is there, then also I can do DEC provocation test. But when ultrasound scrotum is there, तो फिर तो प्रॉब्लम है. तो फिर अल्ट्रासाउंड स्क्रोटम ही होगा आंसर. अल्ट्रासाउंड स्क्रोटम नहीं था तो डीसी, बट यू सेइंग अल्ट्रासाउंड था तो अल्ट्रासाउंड मार्क करेंगे बिल्कुल. ठीक है. सो दिस इज व्हाट वी टेक होम फ्रॉम आवर पैथ माइक्रो रिकॉल, एंड ऑफ कोर्स आई एम स्टिल इन दैट जर्नी. आई हैव I think 1500 unread messages on Telegram. Hopefully once I read those messages, I will get more options out of it. I will make a final PDF and I will give it to you. And I will definitely, you can then, save that PDF for your INI, CET and later exams. Complete videos देखो, mycology हो गया, जन चल रहा है अभी. Can you see this? ये जो background वाला setup है, I am in the studio only. I'm recording rapid revision of Patho. अभी 2-3 दिन होली सब कुछ rapid revision Patho चलेगा, and then I'm also recording microbiology. तो as and when there's Dr. Snehit, there is not going to be any delay. जैसा recording होता जाएगा वैसा upload होता जाएगा. We are doing it like we have a TAT of 24 hours. As we are recording, we are uploading. So on a daily basis, you will see videos are getting 2 hours, 4 hours, 6 hours. ऐसे videos upload होता जा रहा है. So we are trying to do it ASAP, but थोड़ा सा technical time लग जाता है to go ahead with the quality of the video, the editing part of it, right? Correct. नहीं, I am Achan Academy only. I'm in both places. I'm not leaving either. So whichever plan, I mean, I'm the same person with the same brain and the same methodology of teaching. तो जिस भी platform पे you are following me, you will get the same content. Be rest assured. It's not that my brain is gonna work differently on different platforms. So no, you will not get. Why will you get less attention? Every student for me is not related to from which platform that student is coming. Neither does it matter whether that student has come to me via a plus subscription or whether the student has come to me via a special class. A student has just walked up to me randomly somewhere in Gautam Nagar and said, "Hello, ma'am, I have a doubt." It really does not matter to me how the student has come to me via Telegram or Instagram. Same way, student for me with a doubt is just a student with a doubt, and I never ask, "Acha, I will solve your doubt if you are from so and so platform." ऐसा थोड़ी होता है. So no one's gonna get any less attention. For me, everyone is. I mean, I do understand that sometimes I don't give replies because my DMs are genuinely a total mess. Be it on Instagram or Telegram, वो एक total mess है. मुझे समझ ही नहीं आता वो क्या चीज़ message request में पड़ा हुआ है, क्या चीज़ primary chat में पड़ा है, क्या general chat में पड़ा है. I have no count of that at times. I agree, because it becomes too overwhelming to just keep a track of it. Sometimes you don't look at your phone for 12 hours and suddenly you don't know where to start from. So that sometimes can happen. I totally take all the 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 guilt for it. But other than that, Dr. Abhinit, this will never happen. I mean, whichever platform I am at, the intent and the content, everything remains the same. ऐसा कुछ attention का कुछ issue नहीं होने वाला, undoubtedly. Be rest assured. Neither am I saying if I'm on two platforms, you have to go for both and you have to attend both. You stick to one. Whichever one you are comfortable with, please stick to that. And be rest assured that the content of both is going to be equivalent. It's not going to be less or more or any of that. At least for myself, I can say that. And yeah, how many of you are now preparing for INICET? तो मतलब अभी तो नहीं, अभी तो you guys can chill a little. But if you're preparing for INICET, I am not overburdening you right now. But in another week's time, in another 5-7 days, थोड़ा सा settle हो जाओ, at least celebrate Holi a little, at least come back to life, know that there is something beyond exams. तो एक बार थोड़ा सा होली मना लो, and then after that, I am going to come to you with an INICET strategy. So wo hoga, and just in case, so we will have an INICET batch also, which will eventually launch. Meanwhile, there's a next wala launch batch which is going to get launched, and that is starting from end of this month, means March 28th. इसमें जो Patho and Micro होगा, that's gonna happen in the month of May. So May का जो next वाला batch होगा, that will have Path and Micro. For the FMG students, your batches I've kept earlier because your exams are earlier, and that is going to be in April. Your Patho Micro is going to be in April. This is all plus classes that I'm telling you, right? And May में there is going to be next wala batch. ठीक है? So this is just one thing. And also since अभी अभी कुछ करने को नहीं है, time pass करना है, तो ये करके try कर लो. This is a NEET PG rank predictor. So basically whatever you feel now, so you got all 200 question recall now so you have like overdose of recall must have happened in these 24 to 48 hours, I'm sure. So right now you have an estimate, कुछ तो mind में है, that how much is your estimated score plus minus 10. So you can have that entered your NEET PG score and try to get a predicted rank on the basis of that, because everyone's attempting it, so कुछ idea मिल जाएगा, plus अभी करने को नहीं है कुछ, तो might as well do this. ठीक है, so I will be joining you guys shortly. I'm giving you breathing space for 2-3 days. थोड़ा सा chill कर लो, catch up on your sleep, catch up on your family time, get rejuvenated, relaxed, and yeah, after 2-3-4 days, I will get back to you and we will get back on track, and I will give you targets and the same routine of life. The bad routine of life will start for INICET this time. But yeah, that's a cycle. Now that's like, you will realize that's a medico's life cycle. Hamara life cycle kya hai? Exam for months and months and chilling for a few days, then exam for months and months and chilling for a few days. That is your life cycle. So ठीक है, अभी you are in that chilling phase, so make the most of it. I will soon meet you in the exam phase very very shortly. ठीक है, तो अभी my only advice to you is आज and कल. Happy Holi to all. Spend time with your family, friends. Have the best. So I'm giving you 3 days of your life to chill. Today, tomorrow, and even post Holi for relaxation. But uske baad I will not give you any time to chill. So be rest assured that your chill phase has to be the best possible. So today, tomorrow, and 9th. 3 दिन live your life. ठीक है? And do not think about any recall, any rank, any marks, nothing. Bas shut off your phone, all your study grams and study related telegrams and what all you have, वो सब बंद करो, and 3 days spend time with family, friends, rejuvenate yourself, sleep, catch up on as much as sleep you can. So many students had the status update, slept for 11 hours continuously, and then they message me, sorry ma'am, couldn't message you because we've been sleeping since 12 hours. So many students send me that message also. That is also such a happy feeling. वो भी करो, sleep for 12 hours, 14 hours, do whatever makes you happy. For 3 days, do not think about studies. It's a much needed detox that you need, and your body and your mind needs it. So go ahead with it, and then we will obviously start off with the preparation for INICET. FMG students, you guys, I am not giving you so much of time because you have nothing to celebrate as of now. अभी कोई exam नहीं हुआ है, so we will celebrate after June. But अभी के लिए you guys can maximum take a break of tomorrow. That's about it. But yeah, with you also on the 9th, I will be starting off with your daily targets. तो साथ साथ start कर देना, ठीक है? Thank you so much for joining in. Happy Holi to everyone, to you, to your family, and enjoy, play Holi, but stay safe. And I will meet you in the next class. Thank